So your daughter came to me. Actually, you guys came from England to get the treatment done at Stanford, the Sleep Center, for the study. And, you know, tell everybody regarding your experience with...
Well, we didn't actually know that she had sleep apnea until we got here. We knew she had narcolepsy and we thought that's all she had. And then back in 2011, she had a sleep study done here in Los Angeles that showed she had sleep apnea and narcolepsy. So the first line of treatment was to have the surgery at the LA Children's Hospital to remove her tonsils, adenoid, uvula, take it all out. And the aim of that really was to cure the sleep apnea. But interestingly, I remember thinking after the surgery in the months following that she was absolutely no better. There was no change in terms of her napping, her mood, her ability to sustain sleep at night. And that was a little bit messy because we knew that she had narcolepsy, which is very significant. But when we had the sleep study redone, it still showed sleep apnea. So we were fortunate enough that the doctor at Stanford recommended palate. Well, actually, he sought a second opinion from a specialist. And they said, find someone who can do a palate expansion treatment, which I'd never heard of. And I think she was 6 years old at the time. And she had a device fitted by yourself. And you were very patient with her. And then a year later, you took it out.
Yeah, the symptoms that she was having at school and nap time and so forth.
I think the
prior and after.
Yeah, the biggest improvement I noticed was in the first 7 weeks of the palate expander being fitted. And the most significant thing there was that her nap time in the day was reduced because she was having naps at school and at home, but they became shorter and she became a lot more alert and functional and happier, less grumpy, less irritable within the first 2 months really of the palate expansion, treatments having started. So that improvement just increased and sort of at a slower rate after that first 2 months, but it was still steady and in the right direction. And then when she was retested for sleep apnea about 4 months ago, all her blood gases, everything was clear. So at that point, we took the device out.
And how's she doing in school right now?
Yeah, she's probably pretty much top of the class.
Wow, that's great.
Yeah.
Wonderful.
That's huge. It is huge because we didn't know how it would look or how significant the improvement would be. But I think if we had the choice again, and if I'd have known about the palate expansion, I would never have done the surgery. I would have done the conservative treatment first and then seen. So yeah, we're very grateful. I'm very pleased.
Great.
Yeah.
I'm happy. I'm glad.
Yeah. So we just come now for the retainer, right?
Yes, there you go.
We still come back.